Right. And we're live. I'm going to wait a little bit, a couple of minutes for people to get on here, and then we'll start. See where we're at. Hi, Shirley. I will get to that article, I promise you. It's just been busy. Scott Riley, nice to see you, buddy. Glad you're on here. Hi, Mary. Nice to see you. Thanks for all you've done. Josh, hometown boy. Love you guys. Nice to see you on here. Hey, Brian, how you doing? One of my peeps out in Phoenix. Doreen, all right. I'm just waiting. I usually wait about 5 or 6 minutes for everybody to get on, and then we'll start. Donnie, thank you so much for all you've done, Donnie Yoza. Appreciate it. Hi, Sue. Being kind of nice to hear from you. Thanks for connecting. Jason, oh my gosh, talented guy. Nice to see you on here. Scott, not bad for what I've been through, huh? Kathy, there's my girl, one of my neighbors, close friend. Good to see you. Kelly, oh my gosh, she lives 2 doors up from my parents. Nice to see you. Ah, good. Valerie Ann, nice to see you. Thanks for tuning in, guys. Ingrid, oh my gosh, one of my favorite peeps, Ingrid Smith, thank you. Betty, I'm glad I'm home too, Betty. Holy cow. Hi, Missy. Thanks for connecting with me. Yeah, thanks, Kathy, for saying that. Mona, oh, my friend Mona Giordano. Nice to see you. Lori Ann, we're going to, yeah, Clearwater. She's a hometown girl over in Clearwater now. We'll have coffee. Nikki, thank you. Mark Casaro, nice to see you guys. All right. Wow. It's growing. Laura, there's my friend Laura Arndorf. Nice to see you again. Sherlyn Sarnosky, thanks for connecting. Yeah, I do, don't I, Donnie? Frank Grandinetti, oh my goodness, I owe you everything. Thank you for being here. Stacy Hansen, Snuffy, DeStefano, Lori Ray Wheeler. Hi, how you doing? Marilyn, nice to see you guys. Anne-Marie O'Neill, yes. Yeah, Janice Sweezy Shots, nice to see you. Thank you, Mona. I appreciate it. Sandy Lauder, oh, it's a friend of my mom's. Nice to see you. Scott, thanks for connecting. I know you're from Reynoldsville. Debbie Allman-Greiner, nice to see you. Christine, Chris Kush, oh, how you doing? Mike Price, about time, I haven't seen you in forever. Nikki Gerg, I appreciate it, guys. Lauren Green Cummingham, thank you for all your support. Amy Hoffman, nice to see you. Kelly, yeah, I look a little bit better, but still got a ways to go. My buddy, one of my close friends, Brad Crone, Kelly. All right, we're just gonna wait 2 more minutes and then we'll get on. I think I missed Jeremy. Jeremy Bernstein was on there. I forget who, I missed one. I'm sorry if I missed you. You were tested today? We'll have to talk about that. Tracy, nice to see you. Hetty, how are you? Melissa, nice to see you. Tracy Peters Himes, well, thank you very much for the kind words. I feel better. I looked like hell the other day. Mary, how you doing? Maria, my friend, one of my Central Florida peeps, you and Ryan, thank you so much. Yeah, getting my voice back, I'll talk about that. Carolyn Zardner, tell Brian I said hi to. Nice, thank you guys for the support. Vanessa, nice to see you. Yes, thank you, Maria. I did look like death warmed over, believe me. I'm healing nicely. Hildy, oh my goodness. Good, I'm glad you're on here. This is great. Thank you for tuning in. Thank you. The dude abides. Yes, I am. I am abiding. Nancy Wagon, these are my hometown peeps. Thank you so much, guys. Carrie Nash Osborne, one of my oldest friends up in Syracuse, down here now. Nice to see you. Yes, I'm on the mend. Scott Stena, hometown boy. Nice to see you on here too, brother. It's kind of like George Burns said, you know, when he got out on stage when he was like, you know, in his 90s. Hi, Leatrice, my old neighbor. And he would say, he goes, it's nice to be here, but at my age, it's nice to be anywhere. And truly, that's how I feel right about now. So, love you too. Love you too. Hi, Mike Spagnolo. Nice to see you. All right. So let's get into this because we've gone 5 minutes. Tim King, nice to see you. Thank you so much for being on here. This is what I'm going to talk about. And my brother, Dave Piccirillo, he got me through this more than anybody. Thank you, brother. I love you. Lorianne, thank you so much. Taryn, nice to see you. My brother got me through this. Ever since I started being sick, even 2 weeks prior to going to the hospital, he texts me literally every hour, if not 2 hours, and he was with me the whole time. And thanks, bro. Yeah. So City Lee McKenna had been including you in our prayers. Thank you for all the prayers. That's the first thing I want to say. Aside from my family, my brother, my parents that were there and suffering right along with me, even though they couldn't visit, they're up in Pennsylvania. What I depended on was you guys, my Facebook peeps, because I knew I could turn on my phone at any given time and get that support. And a special shout out to my hometown. Now, I've got you know, Facebook friends all over the place. I've got them here in Tampa Bay, Central Florida, where I lived for over 6 years. Even in Phoenix, I lived there briefly. But this little town, folks, if you're not familiar, my hometown, Ridgeway, Pennsylvania, and Elk County in general, but I'm going to give a shout out to my hometown. You guys circled the wagons for me, and you have no idea how much I appreciate that. That is always going to be home. No matter what, that's going to be home. And you really just stepped up, and I moved away 10 years ago, and they never forgot about it. Hi, Mike. Greg, nice to see you. But thank you. Thank you so much, Ridgeway people, for circling the wagons, for being so supportive, so loving, and so encouraging. I'm so grateful for that. So what we're going to, and thank you, one more thank you to the new Facebook friends. As a result of that video, and I'll tell you my motivation for this. The reason I did the video from my hospital room, I was sicker than a dog. I felt I had to, and I'm glad I did. Because I found out there's a lot of people that have no clue about this or whether it's real. And I'll talk about that. It is very real, so I felt it necessary to put a face on it. I had dozens of messages from friends and strangers saying, I didn't know anybody that had COVID, and you have it. So I put a face on it, and that's the only reason I did. I feel a personal responsibility to get information, not make this a political football, but just get real information about what this thing is all about. I'm not going to give you speculation. I'm going to give you real world answers from my own experience and what I've learned from my healthcare professionals. And I'll tell you that, you know, who that is and what they know and all that stuff. So that's what we're going to talk about on here. Now, I got to do a disclaimer right off the bat. I am not obviously an MD, right? I'm not a doctor. I don't purport to be. I'm not going to give medical advice. I'm just kind of like a reporter, like a journalist. Okay, that's just basically my job here. I'm not trying to convince you. Again, I've heard, you know, I'm not going to go in the political end. I understand, and I have my own opinions on the economic impact, which is horrible. I also see the food lines down here in Florida, that people are going through food lines because they can't afford to buy groceries. So this is all tied together. You really can't separate one from the other. But what I'm going to do is focus on my experience about coronavirus and try to educate you a little bit about what's really going on with it, both within a COVID ward, you know, what the healthcare professionals are facing, as well as what I went through. So I don't judge anybody that, you know, has a conspiracy theory. I mean, like I said, I have my own opinions on that too. That's okay. I'm just going to focus it on healthcare because to me, I have a responsibility to just give information. And the reason I say that live video that I did in the hospital bed has like over 22,000 views. People, and I get messages daily, continually, asking about something because they don't know about it, because they know what the media puts out on the news every night, the numbers, and it's shocking. And there is a surge. We're an epicenter right here. Just yesterday, there were 9,000 new cases in Florida. Whereas Pinellas County, where I live in Tampa Bay, it's actually St. Petersburg, there were a number of cases, but very low. But over the last, since I went in the hospital, it was a week and a half ago, since I went in the hospital, there's been a major surge in Florida. And there's been surges, I'd heard 13, now it's like half the country is surging. So let's talk about that. Again, I'm not a doctor, just giving you my opinion and what I've learned. I'm passing on for the healthcare professional. I've had people saying, should I be afraid? Yeah, this is real. Or is this real? Now, when I say that, I'm not doing any fear mongering. Don't let this, there's certain things you can do, because to me, it's not about what the government should be doing. It's not about, why aren't they finding the vaccine? It's about personal responsibility right now. I will tell you this, when I had this thing, I've never been sicker in my life. Now, there's a continuum where people get it mild or people can get it severe. I will tell you, if you get it, chances are you're going to survive it. But it's like I always say, when I was in the hospital, I wanted to either get better or I wanted to die, and I didn't care which. I was very, very sick. So it's a very severe illness. That's why the quarantine, why they took this serious to begin with, because this sometimes rapidly progresses very, very quickly. It's a respiratory virus, from what I understand, similar to SARS. I don't know I think they say it's in that family. Again, that's speculation. And I'll tell you when, I'm not sure about something. If you're not sure, go to the CDC website. I'm going to give you some information on that. They update that as the data comes in. Now, the good thing, there's no good thing about the surge, but the more cases there are and the more data they can collect. All right. This virus is, the problem is, first of all, there's no cure, right? The problem is this virus is really hard to track as far as the behavior of it. What I mean by that is, we know it's a respiratory virus, right? It attacks the lungs for the most part. Usually starts in the throat and then goes to the lungs pretty quickly. But when I got in there, the first thing they asked me, it's like, do you have any nausea? Do you have any vomiting? Do you have diarrhea? Do you have stomach pain? There is a percentage of people coming in, even though it's a respiratory thing, that are having digestion issues where that virus attacks that also. Okay. Now, we've talked about underlying conditions. How did you get it so bad, Tim? I've 10 years ago, I detoxed my body. Actually 6 years ago, I really detoxed and got into shape. Do cardio regularly. I was doing, weight training, pretty toned, eating very clean for the most part, healthy. Thought it was like, the picture of health. I exercised. I was in probably the best shape of my life, 60 years old, right? Why did I get this thing? And how did I get it so bad? Well, it's kind of funny because they talk about underlying conditions. Now, my cardio, you have oxygenation, and they'll check that in the hospital too. That oxygenation is how much oxygen is getting to your brain at any given time. And mine always hovers around 96, 98%, which is really good, so it's very clear. Well, what I found out, now I had this thing, and I'll tell you the progression of it. I had this thing for 2 weeks before I went to the emergency room the first time. And it didn't go to my lungs for some reason. I think it should have a lot quicker, because once I got diagnosed and I'll just tell you what happened to me. Let's start there. So it was June 8th. It was Monday. Now, people ask me, how did you get this? No idea. They did open up the state. I quarantined myself like everybody else for a couple of months. When I went out, I would wear masks. I only went to my chiropractor for my Tourette's, and I went to get groceries. The weekend before I contracted it, I did 2 different birthday party shows in Tampa. Now, the incubation period for this, from what I understand, is 48 hours to 2 weeks. So they say, well, how'd you get it? I have no idea. I could have got it at the birthday parties. I could have touched a food product at the grocery store at Publix where I go to, and then had my mask on, and when I get out to the car, take off my mask, and then just rub my eye. Boom, got the virus, right? So you don't really know. That's why they do know this, that wearing masks will help, because a huge part of the transmission is from human droplets. So wearing a mask does help, no matter what anybody if you don't listen to anything else I say, put the damn mask on when you go outside or when you're with people, because it does make a difference. And if nothing else, if you're not doing it for you, do it for your family or do it for other people so you don't spread this thing, okay? So I'm not going to preach. I'm not going to tell you that. Again, you take the information, you do whatever you want with it. My job is to bring awareness to this thing. This is serious. This is real. There is a continuum. Most people get it and can recover at home. They don't need hospitalization, but there's a lot that do. And these COVID wards, they were diverting. I went to, by the time it started off, my symptoms were Monday, June 8th, and I remember extreme fatigue and weakness, extreme fatigue, headache, fever, and this lasted and came and went for 2 weeks until I was starting to get really sick. So I went to the emergency room because I couldn't take care of myself anymore. I live alone here in Florida. I have a support system in place, but I wasn't sure. So I go to the emergency room and they gave me a battery of tests, including a COVID test. And the doctor on duty, she was a PA, said, she goes, well, we could take care of you, but you'll probably be more comfortable at home. Monitor the symptoms. If they get worse, come back. So, and she said, we'll know the results of the test. Somebody will call you, which they didn't do because but there's a patient portal where my records are that I could access, right? So 2 days later on Wednesday, I looked and I was COVID positive. He's like, well, that makes sense. That's why I'm sick, right? So I didn't panic. I really only, and I'll tell you about that, where I went into fear and thought about death one time. This is a wake-up call for me. It's really, really something. But I really only thought about death one time. But what happened was that morning, the results were posted. I was positive. And that afternoon, I could tell my breathing started getting heavier. And I was starting to go down. And I was smart enough to call the paramedics and say, take me back there. Now, what's funny about this, not funny at all, but I understand it. The paramedics gave me pushback, because they get calls for people with broken arms and I can't walk, blah, blah, blah. And I said, no, I can't take care of myself. And they questioned me, but they took me back to Northside Hospital where I'd been tested before in the emergency room. That's where I got the results, right? So I get to the ER. And they did the same stuff, evaluated me and everything, including doing an influenza test, which they shove a swab up either sinus. I swear to God, they touch your brain because it's very painful. And they did the swab of the code, but they already knew I was COVID positive. But what they found, they did a chest x-ray that the pneumonia had set in. Now, I didn't know this. I have COPD. Didn't show up until that chest x-ray. My doctor wasn't aware of I've had these before. I'm great. I do cardio every day. I'm in great shape, right? I have no problem with oxygen. I don't get winded. I'm great, decent weight, all that stuff. No, that's COPD. But what was something about it, it took 2 weeks because my lungs are strong enough. It took 2 weeks for even, and the pneumonia was very minuscule, but it was starting. And it was really something. So what they did was they said, we're going to admit you. And the nurse said, I got to sleep in the emergency room because they didn't have a bed at that time. They have a COVID wing right now, and they're building a second one. They're putting together because they need it because of the surge. Okay. Thank you guys, Faith, all these guys I'm sorry. Nice to see you all. I'll just keep going here. I slept in the ER until about 3:30 in the morning when they woke me and had a bed ready. And I was on a COVID wing. And it was really something. If you've ever seen the movie Outbreak, that's what it's like. It's they have PPE. It's the protective equipment. Even before you're in your isolated room, even before they come in, they are geared up. They put on, the plastic apron, gloves, a face mask, as well as, the typical surgical mask, as well as a full frontal plastic mask. It's really stifling for them, and every time they go in and out of the room, they have to change. They throw the gloves and the apron in the biohazard container in my room and throw that out. So, hi, Eileen, thank you. So the bottom line is, what they did was I was hooked up to a machine 24/7, where they would monitor my blood pressure every 2 hours it was taken, and my oxygenation, as well as my EKG. You are at risk if you have, some high blood pressure. Now, high blood pressure runs genetically on both sides of my family. Both grandfathers, my dad, my brother escaped it, but I have just low-high range. But here's the deal. That didn't really matter. That was not an underlying, was the pneumonia. By the second day in there, the next day, I could tell the pneumonia was growing, and I was starting, even because this, again, the virus attacks the lungs. It's respiratory, okay? So what I did was, I could tell I was sick, and I not only had a hospitalist, right? That was my primary doctor in there, but I had a pulmonologist. And this guy, Dr. Middleman, is just brilliant. And it's really something. I had a lot of people after I did the live, messaging me, and I want to thank Phil Bernard. Phil Bernard is a good friend, owns Magical Meat Boutique, a karaoke British pub over in Mount Dora where I used to live. And he sent me an article through Messenger, and he's originally, he's British, he's from the UK. And he said, my friends I've got a number of mates over, and the doctors are trying this, and it's been very successful. So what it is, it's a steroid, and it is called, hold on here, I apologize because I was messing it up, dexamethasone, and it's a very cheap steroid. Now, I never knew there was something more powerful than prednisone, but I guess this is a step up. So basically, to treat the pneumonia, they did what they normally do. They do the Z-Pack, and then they also gave me an IV antibiotic because they want to knock this thing out of me. What the doctors are doing basically is taking care of the symptoms that the virus causes, because they don't have a cure for the virus, all right? Viruses, antiviral drugs don't work on this. Antiviral drugs only work on some viruses, because what happens is, if you get a virus at the very beginning and catch it with an antiviral drug that can stop it, it might work. But if that virus goes down into the cell, what they call the myelin sheath, it goes real deep, basically what happens is that your immune system can't track it, doesn't even know it's there. And that's when the virus starts replicating and goes throughout your body and makes you sick. Antibiotics don't work because antibiotics are for bacterial infections. This is not a bacteria, this is a virus, right? And it latches onto the host, which is me, inside, and then replicates. So the only thing that kills it is your own immune system, your own body, right? So what they have to do is all these secondary things, they have to take care of those symptoms and then hope that your body will kill the virus. And most of it, if you have a strong immune system, it will kill the virus, all right? That's why people with compromised immunity have a difficult time or are more susceptible and really should take precautions. I have a friend that was recently diagnosed with RA, rheumatoid arthritis, and some other immune stuff, and she got this back in March. Contacted me she was still battling it, the residual effects. This, takes a while to get out of your system. So that's basically what did they do? Okay, well, they're attacking the pneumonia, but at the same time, I couldn't breathe. So he said, I'm going to give you this shot. He goes, and he leaned in. This Dr. Middleman was just so compassionate. These guys are putting their lives on the line, whether the nurses or the doctors are coming into your room, they could get it, right? I had a couple of nurses. These people are pulling 12-hour shifts. Can you imagine the stress? And a couple of them were young ladies, very professional, diligent professionals, but you could tell they were scared. Can't blame them. Should be, right? here I am, I'm 6 years old. I'm laying flat on my back. There's no cure for this. They're like, what the hell are you going to do for me? But at the same time, I knew I was cared for, and I was just kind of serene. I did think about death one time when before I got that steroid, he introduced that intravenously. I was going down pretty quick, and I thought, okay, God, either way. And where I learned this was a good friend of mine, Terry Titchener, who had throat cancer. This is over 30 years ago. And and I don't know if it was larynx cancer or esophageal cancer, but I remember asking him about it. In the ward that he was in, the guys were dying because the mortality rate was like 95%. And they were all dying around him. And I said, man, you're facing that. How did you feel? And I never forgot his answer. And this answer, he told me like 20 years ago. He said, whether I lived or I died, either way I knew it would be all right. Wow. Now that's faith. So basically that's where I was. I had that flash of fear. Now, don't get me wrong. Don't think I'm this courageous, brave guy. I'm not, man. I'm like anybody else. I got fears, insecurities, and everything else. But for some reason, I recognized that I didn't have any control over it. And if I die, I die, right? The good news is you're most likely, very high percent, you're not going to die. Unless you're very old, unless you got a lot of huge underlying conditions, right? All that stuff. So Sharon, thank you very much, Sharon. I appreciate that. That's the good news, okay? The good news is you're probably not going to die. If you get it like I did, you're going to want to for a while, but you're going to come out of it, all right? And a lot of the cases are very mild, and some are asymptomatic, right? So what are the symptoms? Well, I told you some of mine. So if you're getting these, these are right off the CDC website. It seems like, and they're trying to figure it out still, but they seem like if you have heart or lung disease or diabetes, you might be more high risk, or high blood pressure, things like that. If your immune system is compromised anyway, you're more high risk also. We kind of know that. Symptoms can include fever or chills. All right, I had fever, came and went. Tylenol took care of it, would break the fever, but it doesn't go away, it comes back. Cough, all right, I had sinus, and that's what I thought was causing my cough. It's draining, how that, and you can hear it in my voice still. I have a little bit of sinus, right? Fatigue, I've never had fatigue to this degree. Now, I've had chronic fatigue off and on for 20 years, but I've never had it like this. Muscle and body aches. Didn't have a whole lot of that, but it started with a severe headache. And so that's part of it. Now, this is something too that's pretty common. Once you're into the disease, the virus takes hold, you lose your taste and your smell. So that happens too. Sore throat, because the viral load usually goes to, your throat and then tries to head to your lungs. Congestion, runny nose, nausea or vomiting, and diarrhea. Like I said, they're trying to track the behavior. Why is this going down there? Not everybody has that. They had to approach that with me too, because I want to say 2 or 3 days in, they started giving me a shot directly into my abdomen every afternoon to prevent blood clots in my stomach. Now let me tell you about this steroid. Steroid, again, they've got to manage the symptoms, but they also have to manage the medication. It's kind of like chemo. You have to balance the good with the bad with chemotherapy. And I've never gone through it, but I've had friends who've gone through that the chemotherapy, when they introduce it, wipes out the cancer, but it wipes out a lot of good stuff too. So what they did with me, what this steroid did is, first of all, there's side effects, major side effects. The whole idea was to open up my breathing, which will work very well. That's what steroids will do. I don't know the exact mechanism. I think it dilates, I don't know how that is, the blood vessels in there. It also reduces inflammation in the lungs. So it's very effective, extremely effective. Downside is, does a lot of stuff. A lot of side effects, which are kind of dangerous for somebody like me. It elevated my blood pressure, so that's why I didn't monitor it. In fact, I kind of had to double up. I only take a moderate dose of lisinopril every morning. I had to double up. This is the first day I haven't, because my doc said, well, you might, because things are starting to stabilize as I wean off the steroid orally. The biggest thing was it will spike your blood sugar. It spikes your glucose levels. All right, and again, this is what I'm talking about here is the dexamethasone. And look it up. It's a steroid, corticosteroid is what they call it. Hi, Jody. Thank you. Appreciate it. So basically, the biggest thing is it really shoots blood sugar up, shoots your blood glucose. Typical ranges are between 70 and 110. After that, and they did it in IV because they had to do it hardcore. And he said, you're going to breathe better, you're going to feel better. He gave me the shot. I was exhausted. Steroids stimulate you. But I took a 2-hour nap. When I woke up, I actually felt better. I could breathe. The steroid had taken effect. On the other hand, my glucose shot up to 279, which is pretty dangerous. So what they do to offset that? They shot me up full of insulin, right? Because I stopped producing insulin. Now, I got Tourette's syndrome. Anybody knows me, you see me tick like that. Any kind of stimulant will do that, but they had to do that. They had to, balance that out and give me that insulin. And I'm like buzzing for hours. I don't care. It was fine. I could deal with all of it by that time because I'll get to that too. It's not about, not all about the body. This is what got me through. You guys, this. You guys, and this. And I'll talk about that. So the bottom line is they had to manage all that stuff. And then every morning they would take 5 vials of blood. That's pretty much the protocol. They're doing labs to see what's going on in your body, where the virus is, what the viral load is, I assume, as well as all these other different levels. They did a chest X-ray every single day to see how I was doing. Again, they had me wired continually. So like I said, I didn't know I had pneumonia. That took 2 weeks. I didn't know I had COPD. First stage COPD, who would have known? My cardio is great. So the point is for that is please be aware that you might not think you have underlying conditions, but you could, like what I did, So that was the biggest thing. So again, that was my treatment. The aftercare, yesterday I got a call from the hospital. I'm still COVID positive. And that can happen, my doctor said, my primary care doctor said, that can happen for 2 or 3 tests. It can take, my doctor in the hospital said that you can get this for, sorry, I'm not bringing anybody in the video right now, but I appreciate it. You can PM me with any questions. The bottom line is it can take, he said, 2 months to get this out. Now, here's what's cool about that once this virus is totally out of my body, I'm going to be able to donate my blood plasma because now they're finding people that have formerly had COVID-19 that are totally free of the virus but have the antibodies. They take my plasma, and for people that are severely ill with COVID, my plasma will help boost their immune system. They're seeing that as a very effective first step to treating to boost the immune system of people that are suffering from this. So that's a really good thing. And I guarantee you I'll be donating right and left as much as I can just to prevent people from going through this. So I also had to be on a diabetic diet because of what the steroid does. Everything's leveling out now. My aftercare consists of, I have my primary care physician, my medical Florida Blue, which is Blue Cross Blue Shield down here. I have a care manager for that. She gives me all kinds of information, checks in once a week. Northside Hospital, not only do I have an app on my phone where they monitor me. And if I have any help, there's a chat, there's an after hours number, I'm taken care of. So people ask, do you have a support system even though you live alone? Yes, I do. I have a neighbor next door that just does all kinds of stuff. I've got friends that run for me. I have my groceries delivered. Hi, Janet. Nice to see you. I have groceries delivered. I even have, for the first few days, I have my meals delivered. I'd order through DoorDash.com. There's a number of to eat healthy. Thank you, Patty. I appreciate that. It's a response. she just said, thank you for sharing what I'm going through. I feel a responsibility because people don't know. You know, that's the only reason I do this, just to educate people about what's really going on. It is real. It's not, you know, the government, I don't know how you feel about that, but they're trying to protect you. You know, I think they opened up, they got about, we're not going to go into that, but my point is this thing is real. It's surging. People are getting sick, very, very sick. One thing I will tell you, the people, when I talked to my Florida Blue lady, I think it was yesterday, I was worried about people when you get to the point of being on a ventilator and you have to be intubated. And there were a number of cases that were intubated on my floor. In fact, as I was wheeled out Tuesday, the last room I looked and there was a guy on a vent. Here's the good news about it. It used to be you got on a vent, it's like they're really worried. Now you're going to go down, you know, you're dead. Not so much. She's seeing most of them get off the ventilator. We've come that far where, you know, because it gets to the point where you can't breathe for yourself and they have to basically put you in a medically induced coma and then the ventilator breathes for you. And it used to be like that was not a good sign because they were worried, and they're still worried about the long-term effects of that. If you can't breathe, is there fibrosis in the lungs? Well, and some people are having different difficulty. They don't know because it's too soon, right, to tell what the long-term ramifications of this are. But for me, the aftercare is, again, what I just told you. Thank you, Lillian. I'm on a diabetic diet for a while till my levels. They're weaning me off the steroids. I only have 2 more days, tomorrow and one last pill Monday. I was able to do it orally to step down for the last few days. I can't wait to get off them because the good thing is it stimulated my appetite. Steroids will do that. I hadn't been eating, just hydrating because the fever would just burn me out. But the bottom line is things are starting to stabilize. I can tell my body is fighting it. I can tell I'm winning because I'm getting more energy every day. They told me it's going to be a slog. My doctor said, you know, it's been about a month now, and he said it's going to be about 2 months. So, but it's coming back. And what's cool about this too, I got to rehab my lungs, and you know, there's people that do the deep breathing and everything. I sing because that's my therapy, and it was really something. I'll just tell you, for those that have had people, we want you to sing a song again. It will be coming soon. 2 nights ago in the shower, I actually found out, I sound bad now, but my voice is still there, and my wind is really strong. My oxygenation, I didn't really lose a whole lot. I was really shocked, really shocked. So that was really, really good news for me that, you know, I've made this much progress. I've only been out of the hospital since Tuesday night, and I'm really, really grateful for that. So let me see what else we have. All right, now let's talk about just real quickly the testing. Now, I'll just say this from the CDC website. I got my laptop in front of me. This is directly from them. People who have fully recovered from COVID-19 have antibodies in their plasma that can attack the virus. This convalescent plasma is being evaluated as treatment for patients with serious or immediately life-threatening COVID-19 infections, or those judged by a healthcare provider to be at a high risk of progression to severe or life-threatening disease. So they're finding definitively right now that this plasma is helping a lot of cases with people from progressing, and it just builds up because my antibodies in the plasma will build up their immune system. Cool stuff. Really happy. Now, there's 2 types of testing. I had a friend of mine reach out to me this morning that I haven't heard from in years and years, and he was camping with 2 friends, and he's showing symptoms. And he said, what should I do? Or this guy said, you need to be tested. So there are, hi Lynn, thank you. Peggy, Reed, thank you. God bless you guys. There's 2 types of testing. The first one is the viral test itself. It tells you if you have a current infection, okay? Somebody is at my door and they're just gonna have to go. You know, hi Shane, how you doing? I can't believe anybody knocks on the door during the pandemic. I have no idea, but they're gonna have to wait. Anyway, viral test tells you if you have a current infection. Most people, this is on the CDC website, most people have mild illness and can recover at home without medical care. Now, here's the thing though. If you test negative for COVID-19 by a viral test, you probably were not infected at the time your sample was collected. However, that does not mean you will not get sick. The test result only means that you did not have COVID-19 at the time of testing. You might test negative if the sample was collected early in your infection and test positive later during your illness. You could also be exposed to COVID-19 after the test and get infected then. That's the first test. That's the diagnostic test. That is the test that is telling you whether you got it or not. And you saw, again, CDC website, cdc.org. Go on there, you'll get all this information. Now, the antibody test, which I was ordered for my blood work prior to even going into the hospital knowing I had this, what they do is they will test you for antibodies. And an antibody test might tell you if you were exposed to the virus, whether you had a past infection or not. A lot of people are saying, I think I had it back in February. I think I had it. Well, that antibody test will tell them whether you had it. Now, it might not show if you had a current infection because it can take, like 1 to 3 weeks after the infection. After, like for me, it won't show up sometimes 1 to 3 weeks afterwards for those antibodies to show up that, oh, Tim had COVID, right? So here's what they say. Having antibodies to the virus that causes COVID-19 might provide protection from getting infected with the virus again. If it does, we do not know how much protection the antibodies might provide or how long the protection might last, which I've known. They say if you're asymptomatic or you have the antibodies, you're immune. No, they don't know that. Some people are, some people aren't. And even the people that are, they don't know how long it'll last or if it'll last. They're still, again, tracking the behavior of this virus. The only way they do that is to compile data from all these different cases coming in. So that's basically, what's going on with this and where they're at. They're taking care of the symptoms. They are, I heard Dr. Fauci just the other day, they're diligently working on a vaccine, and there's a bunch of them in trials, and he actually expects it to fast track a little bit. He said by the end of this year, early next year. Now, whether that's true or not, I have really no idea. Remember though, this thing is serious. It is not, it's not a hoax. It's very real. Most likely you will survive it. You might want to die in the meantime because if you get sick like I do, it's severe. So I wrote some 6 little points here. And this is what I'm going to end with. So people would say, should I be afraid? And I say, well, caution, don't let it overtake you. And then let me just say to health department doing follow-up with the impossible. I'll talk about that in just a second. Shirley, remind me, come back to that. Shirley Gradisi asked, because I'll take some questions on this. She asked a good question about the Department of Health. Yes, I was contacted. And I'll tell you, I just talked to a friend of mine about this. Are they following up your possible contacts? Are they doing tracing? And I'll tell you about that. Just my opinion on it. So here's the thing. Have a healthy fear of it. You don't have a lot of control if you're going out a lot, because I don't know how I got it. I wore a mask all the time. I even wore gloves. I did, washed. I never left except for the chiropractor, the grocery store. But did I touch a canned food and then took off my mask right in the car and then rubbed my eye? Boom, did I get that way? Was I at the birthday party and one of those kids were infected? Have no idea, right? So just be cautious. This is not about, the government telling you what to do or not to do. This is not about healthcare professionals. It's about personal responsibility. Okay? Do what you want to do. Remember though, that what you do when you go out and you're not wearing a mask, you're impacting other people. Just remember that. That I will say. You could infect somebody else and you don't even know it. Or think about your family. So I'm not afraid of this, and you go out and you get it, and then they see you lay in the bed like I was. And if anybody saw that Facebook Live, you saw how sick I was. Think about how that affects your family. Now, I'm not trying to do fear mom. I'm just trying to reality. Wake up, man. Wait, this is a real thing. You should have a healthy fear without, going overboard on it. Realize it's real. Realize it probably won't kill you, but why take the chance, correct? Okay. Now, here's the biggest thing that got me through. And I'll be doing, I'll tell you my plans, because when you're flat on your back and you've got a disease that the doctors know nothing about, essentially, and you could die, you get a little different perspective, including a lot of gratitude. I'm grateful as heck. I'm grateful to you. I'm grateful to God. I'm grateful for the prayers you threw throughout because they worked. I have a totally different focus right now. My focus is on awareness with this thing. I probably won't do a live for a while because I'm giving you everything I know. Here's one thing that saves me, and anybody that knows me knows I started studying personal development in 1986. Now, I've been through a lot of adversity in my life, like everybody else, but I've had kind of more than my share. And I don't say that to say, oh, I've had problems. No, I've just had to learn to deal with a lot. I was diagnosed with Tourette's syndrome in 1975. They knew nothing about it. I was on my own. They're trying all this medication. With all that goes comorbid conditions, co-occurring depression, anxiety. Had to deal with all that. Tried to self-medicate. Had to go into recovery for alcoholism. I've been sober for 19 years now. But that was, another thing, a struggle, just adversity. Went through all this different stuff. And then now I've thankfully survived COVID. What got me through? More than anything, my attitude. It's cultivating that. And I got away from it for a while. It used to be, I'd wake up, and people say, the self-help industry, the motivational stuff, that doesn't work. Yeah, it does. I started studying this person. That's why I became a speaker. I believed in it. These principles of positive thinking, it's not what happened. My whole message as a speaker was, it's not what happens to you in life that matters. It's what you do about it that makes a difference. And that's all up here. That's mental toughness. And that can be learned, and that can be cultivated, and that can be reinforced in your brain where it becomes a habit where you can cope with things a lot easier, okay? I'm going to be doing a full-blown course. I'm going to be putting out a course in the next couple of months on how to overcome adversity, and that's going to be a huge component. I'm also going to give you really tools, methods, and techniques that I've used to get through virtually anything, and I guarantee it's because adversity, we all go through it. Life is a struggle. If you ever read the book, The Road Less Traveled, bestseller back in the 80s, might have been the 70s, the first line that M. Scott Peck wrote in the first chapter is, life is a struggle. I think that's what it was. And it is. It's just, even the Bible says, and I'm not a Bible guy, but the Bible says, in your life you will have tribulation, something like that. Life's a struggle. We have problems. It's not an easy ride. It's peaks and valleys. And it's how you deal with it. And that more than anything, and you guys, because no man is an island, that's what I learned. I can't do life alone. I couldn't do it. God bless you all for being there and helping me. That support meant everything. But at the same time, personal responsibility, it's up to me to keep myself boosted. Nobody can do that for me, right? So I had to learn how to do that. Your mental attitude, and I'm a big mind-body connection guy. Your mind impacts your body. So keeping that faith and keeping that positivity up has helped me heal. And it's helped me heal exponentially. It's not even a faith or a belief in that. It's a knowing. I know why I'm getting better because I'm lucky to be alive. This whole week I've been on cloud 9. Can you believe that? Now, again, I've just trained myself to think that way. Gratitude is a huge tool for me. I'm lucky to be alive. I'm just so grateful for that. It's just a blessing. If you've been on that side, you look at things differently. So remember that mental attitude, start cultivating. I'm starting to, listen to uplifting people like Jordan Peterson. I've always been a Tony Robbins fan. Les Brown. Feed my mind full of that positive stuff. Getting back into that habit. I used to do it all the time. That's why it's ingrained in my subconscious. So remember, that mind will impact your body. If you get this thing, you can speed healing just with your mind. I can tell you right away. Don't try to do it alone. Last thing. I had support. No man is an island. I love that quote because I can't get through life alone. I relied on you guys. I relied on a lot of people. I'm so grateful for social media, my Facebook peeps. I didn't go anyplace else. My Facebook peeps that's all I need, you know. So the bottom line is, it's real. Protect yourself. If you do nothing else, wear a mask when you go out. Try as much as possible to stay inside. I know my friends up in Pennsylvania haven't been affected as much in the rural areas. Thank God. Good. I hope it stays that way. Hi, Erica. Nice to see you. Hi, Janine. So the bottom line is, just take care of yourself, and don't even think in terms of somebody telling you, when you can come and go. Think in terms of your family and how they would feel if you got this. And just go back to my video and see how sick I was. Now, people say, well, I probably won't get that sick. You might not, and I hope you don't. I really hope you don't. But it's better to err in something like this to caution than to go the other way and to poo-poo it. This is nothing to poo-poo. This will, thank you, Christine, for saying that. Hey, John Castellani, and Donnie, my brother. Man, we're going to sing, you and I. So, folks, I'm done. And if you have any questions, PM me, text me. It takes, sorry, Jim, right now I'm just not bringing anybody in. I appreciate that, though. Text me with any questions. Again, I'm in touch with my healthcare professionals to see how this stuff is trending. What they're learning about it from the frontline workers. Some of these nurses they're just dedicated. I mean, all of them are dedicated professionals going in COVID wards, taking a chance on getting and caring for people like me. And some of the younger ones are scared, and they should be. It's a serious thing. So thank you all for everything. Feel free to message me here on Facebook. I will get back to you, try to get back to you within 24 hours. I'm usually pretty good about it, but I'm still convalescing. I'm feeling a lot better, but I'm still weak. I lost some weight, and I didn't show my whole body here, but I've lost some muscle mass in both my legs and everything. That's natural when you're laying in a hospital and you can't do a whole lot. But just let me know, because my job through this is just to create awareness. And I don't care of the naysayers or people that are, have different opinions and just try to politicize it. That's fine, let them do it. My job is just to create awareness and tell you what's going on, that this thing is real. You don't want to get it, and protect yourself. Okay, so thank you all so much. And I will be doing a song probably in a few days. I still got a lot of convalescing to do. And I appreciate your support and your love and your prayers. It hasn't gone unnoticed. I'll be forever grateful to you. So thank you, guys. Have a wonderful Saturday night, because I am, but I'll probably be in bed a lot earlier than you will. Take care. I love you, all of you.